whatever your protocols are for determining where that adjustment is going to happen. There's a lot of power in doing your checks, delivering that adjustment, and stopping that normal routine. Greetings, doctors. Here we are with another in our INNATE series of videos for you in your practice. I'm Dr. Greg Miller with AMC. Just want to welcome you today. We're going to be talking today about check and recheck. Now, it is a very common thing inside the AMC system for what we call bump the slump. That's not necessarily the point of this particular video, but what we do want to do is help you understand that it's very easy for a patient to become accustomed to the routine in your office. They know which door they're going to go through. They know where they're going to stop and wait. They know when they get in the room, they're moments away from an adjustment. They know what you're going to do as you deliver that adjustment. And that routine ultimately can be a negative thing. It's a positive thing, but at the same time, it can be very negative because it's very systematic and they get really used to that. So what we try to do on occasion is what we call bump the slump, and check and recheck is such a tremendous example of that. And I think back to my experience in practice, and certainly as a Gonstead doctor, I'm scoping each patient and checking them, palpating, motion palpation, whatever your protocols are for determining where that adjustment is going to happen. There's a lot of power in doing your checks, delivering that adjustment, and stopping that normal routine. Because a patient's going to be like, okay, I'm going back to therapy or I'm out of here. And if you stop that and have a face-to-face with them and say, hey, you know what? Today we're going to recheck this. So I'm going to have you, or you need to, not, look, this isn't on, I want you to. You need to go ahead and go to therapy, and then we're going to rest you for a few minutes, 15 minutes, 10 minutes, whatever it is, with ice, and then we're going to come back in and we're going to recheck this. I'm questioning the progress in a certain area, or I'm not pleased with the results we're seeing in a certain area, but ultimately we're going to bring it back in and we're going to check it again. Oftentimes, if it was in the middle of winter, I would send those folks out and have them walk around the block. I want you to take a walk around the block. I want you to come back in here and we're going to recheck that, because I want to make sure that adjustment accomplished what it needed to for you today. Now, that period of time between when they've been adjusted and when they get rechecked can be a really powerful time for them as well, because people's schedules anymore are so tightly driven and they're so wound up. A walk around the block for somebody could be a really, really powerful experience. Or, we had massage chairs. 10 minutes on the massage chair gives them a moment to themselves that perhaps is more important than even the recheck is in that situation. But look, docs, I just think that's a powerful tool. It's a tremendous opportunity. Certainly you upper cervical doctors, you're doing that most of the time anyway. So figure out a way to tweak that so that it becomes something very, very powerful for your patient's experience in your office. Remember, we're looking for you to be the go-to doctor in your community, and that means you do things extra and you do things special for your patients as often as you can, because you want them to remember that experience in your office was one of the best moments of their entire week. That's what we want for you. That's what you deserve, and certainly that's what your patients deserve. If you like this video, go ahead and click that thumbs up like button, hit the bell so you get subscribed when we put out a new one. And always, always, always check us out at amcfamily.com. So much there for you to learn more about AMC and who we are. I appreciate you, and we'll see you next time.